Bluetooth enabled.
然后那都没问题看，他不是有人要讲话没有的。还是开始了没？
Xem hiện ở như nào.
Джеймс Бонд для нас не герой. They tend to grow between Russia and the US. Политику западных, российских и обратно ожидать. Они почувствовали, что миром можно
this coming out of the book. But it shows that what Donald Trump did with Russia, asking Russia and Ukraine to interfere in an election, he also did with China, something that no intelligent country in the world would
好多人哦。
Good afternoon, everybody. Welcome to Penang Adventist Hospital. And thank you for spending your time with us and taking the first step to ensure a healthier and stronger you. Today, thank you to Anak Hutan. I want to thank my brother Kenny for bringing all of us together today without much, we want to invite two very great doctors in Penang Adventist Hospital who will share with you. Good afternoon, everybody. Welcome to Penang Adventist Hospital. And thank you for spending your time with us and taking the first step to ensure a healthier and stronger you.
It's the YouTube.
Today, thank you to Anak Hutan. Okay, so today, without further ado, let me invite Dr. Chang to share with you about sudden cardiac arrest. And after that, Dr. Talal will take over. So no worries, don't worry. We will give you the complete picture of how your heart functions. I know most of you are sports people, so you will be prepared. So let me invite Dr. Chang.
Hi everyone. Good afternoon. Have you had lunch? You can show all these. How can I ask for response from them?
They cannot answer you.
Oh, they cannot answer me.
Put chat box.
Okay. So can you write something in the chat box? Can you hear me well?
I think now I off it.
So today I'm going to talk about
See whether you
something
can
that I've been talking for years. I already informed Ronnie that year in, year out, I'm talking about almost the same thing, because at the end of the day,
I have to, you say what? I have to stop.
all right, can you see? All right. Okay, can you see the slide now? All right. How to go to the next slide?
Yeah. I think I
Okay.
stopped already.
So
Already.
the reason why I was approached to give this talk is because I think recently some of our friends
I
had some friends who actually had sudden death.
Stop the video.
They die suddenly. And to be frank with you, this is something that we do see every now and then.
Only one
You have
line.
stories about
Yeah,
celebrities
crossed
dying
already.
suddenly. We have people whom we know that collapse suddenly, or some even dying in their sleep. And this is something very traumatic, right? So if you look at the first slide, this slide is about this guy called Nikolai Anikov. He basically discovered about atherosclerosis. Atherosclerosis means basically narrowing of your blood vessels. The blood vessels that are involved could be coming from the cardiac system or could be coming from the cerebrovascular system. And years ago, we know that atherosclerosis cannot form without cholesterol. And high cholesterol is something that's very common among us, something that can something that we can actually detect just by doing a simple test. Okay, so let's go to the next slide. How to go next one? All right, all right. So as I said, dying suddenly is getting more common because people are getting more and more informed. And it's a very traumatic experience.
Okay.
There are many causes of sudden death, but there's only one single most common cause, that is ischemic heart disease. Literally speaking, is basically it refers to our pipes in our heart system getting clogged. And if you look at articles and news, every now and then you know that the leading cause of death, not only in Malaysia, in many parts of the world, is heart attack. All right, and it affects all groups of life, especially those who are 45 years and above. And even in the year 2018, let me see.
They can see this one, they cannot see your face.
All right. Time and again, the leading cause of death is still ischemic heart disease. And not to forget, the third commonest cause of death is cerebrovascular disease, or literally stroke. And even last year, sorry, right? If you look at one article from Star, the average death per day because of ischemic heart disease is almost like 50 per day. And many of these people who die are people who stays in the urban areas. And suffice to say that men are affected more than women. Okay, what is the good news? The good news is ischemic heart disease is something that is preventable. But most of us, we are, I would say, literally not bothered because it's a lifestyle issue. All right. And it does not only affect the people in Malaysia only. It's a global problem. You go anywhere, the top number one killer is still ischemic heart disease. And this has to do with the change in lifestyle secondary to urbanization. So in actual fact, if you live a very healthy lifestyle, it is not easy to get clogged pipes in our heart. This is a very important study done many years ago, and it's published in a very important medical journal. So they have identified 9 risk factors that is responsible for people who get heart attack. So if you do not have these 9 risk factors, it is actually essentially not easy for someone to get ischemic heart disease or heart attack. So number 1 is dyslipidemia, high cholesterol. Number 2 is history of smoking. Number 3 is high blood pressure. Number 4 is diabetes. Number 5 is obesity or being overweight. Number 5 is lack of physical activity. Number 6 is, as what I've discussed with Dr. Tala just now, is stress, psychosocial factors. And of course, you don't be surprised. In Malaysia, the recent National Heart Survey, they found that 90% of Malaysian people do not take enough fruits and vegetables, right? And finally, alcohol use. So if you look, if you can if you address these 9 risk factors, it's very, very difficult to get ischemic heart disease, right? Okay, I just want to show some data. This data is from the National Health and Mobility Survey way back in 2015. The latest survey was done last year, but I'm going to share the one in 2015. You can see across all age group, the risk factors that I mentioned just now are very dominant. Okay, you can see that, for example, people who are obese, the red bar, 50% of our people are overweight or obese, and around 20 to 30% of our people have high cholesterol, and almost 1/3 of us have hypertension, and our diabetes incidence also is going more and more common. So this is bad news. So if you don't address all these risk factors, you would easily get ischemic heart disease or stroke. I can't go forward. Oh yeah. This is a very important slide. Across the world, high blood pressure among all the risk factors that I mentioned just now is the most important risk factor because it is one that kills the most people worldwide. And it applies similarly to us in Malaysia. So if you have high blood pressure, your risk of dying, whether you are male or female, can go up to a range of 20% if you don't have blood pressure that's adequately controlled. And can you imagine if you have high blood pressure, you smoke, you have diabetes, you have high cholesterol, or you have high BMI, your risk of getting cardiac events and death will be amplified. And this is a very scary data. Up to 3 in 10 of Malaysian people have hypertension. And you know that hypertension increases with age. We can't run away from getting high blood pressure. As we age, our blood vessel age together with us. And when we age, our blood vessel becomes stiff and high blood pressure is going to be more common. The worrying part is only 50% of people have hypertension knows that they have high blood pressure. So it is a disease that slowly kills us silently. And what is so difficult about checking your blood pressure? Nowadays, if you go to any pharmacy stores or even supermarket, you can easily get a blood pressure machine. And this blood pressure machine is very user-friendly. And it is not costly because having one would be enough to check blood pressure for the whole household. I'm very surprised that some patients who come and see me with end organ damage, those with heart failure, those with kidney failure, they already have high blood pressure for many, many years, and they are not even aware of them having high blood pressure. So this is something that I feel that should be improved because now we are living in the world of 2020. And there are certain numbers that can help us. If you come to see us in the office, we will take 140/90 as the cutoff point. If you check your blood pressure at home, the cutoff point is 135/85. 135/85. You don't need to check it every day. Even checking your blood pressure 2 to 3 times a day would suffice. 2 to 3 times a week would suffice. Check it once after you wake up from your sleep, and then you can check it once again before you go to bed. Yeah. So don't check it during daytime when you are busy walking around because those blood pressure would not be very accurate. And we want to treat, sorry, there's a spelling error here. We want to treat blood pressure before complications set in. We know that hypertension in most patients, they are silent because many of these patients are asymptomatic. So what are the complications that we want to prevent? We do not want our patients to get a stroke. We do not want them to have heart failure. We don't want them to have renal failure. And we also do not want them to have peripheral vascular disease or ischemic heart disease. And this is a very simple slide to show that regardless of your age, as long as you can reduce your blood pressure, you do get benefits in terms of cardiovascular mortality, right? Every 10 millimeter mercury of reduction in your blood pressure can reduce your risk by 16 to 25%. And the same goes to stroke. And the next thing I want to talk about is diabetes. A lot of times people say, so what, right? It's so common. Yeah, yes, it's very common. And it is very shameful for me every time when I attend international conference to admit that the incidence and the prevalence of diabetes in Malaysia is so high. Almost 20% of adults in Malaysia have diabetes, as compared to most countries where their incidence or prevalence is only like 5 to 10%. And why is it so? I think it's partly because of our lifestyle. We are not eating food that is very healthy, and we are not exercising enough. And as a result of that, people get overweight and they become obese. It's very difficult to get diabetes when you are not overweight. And this is a very, very scary slide. If you look at the one over the left side, the two red bars. This red bar basically tells us that once you have diabetes, as compared to those who don't have diabetes, your risk of getting death secondary to a heart attack or dying suddenly is definitely around 2 times higher. And for people who have diabetes, especially if they get it when they are young, they would already have lost a certain number of years of life. For example, if you are to get diabetes at the age of 40, you would have lost around 6 to 7 years of life because of diabetes. So basically your lifespan will be shortened. So I hope that you can wait for a while. There's some problem with your slides. Oh, okay, good. Okay, the next thing is, I think we have to agree that Malaysians as a whole love sugars. Many of us like to drink coffee, for example, but a lot of times it's not because of the coffee that you want to drink, it's the sugar that is tempting enough to lead you to drink coffee. And there are many ways you can have sugar in your drinks. You can either make your drinks yourself, or you can drink drinks that are already being packed with sugar, like carbonated and non-carbonated drinks. The next killer are the pre-mixed drinks. I have many patients who drink 3-in-1 coffee, 3-in-1 tea, and in the long term, they get diabetes because of that habit. So on average, this is how much we consume from our sugary drinks. Our self-prepared drinks is around 3 teaspoons of sugar daily. Carbonated drinks, around 6 teaspoons of sugar daily. And the pre-mixed drinks, roughly around 3 teaspoons of sugar daily. And some of the common drinks that most Malaysians drinks, like Milo, contain almost 40% of its content as sugar. Okay, the next thing I want to talk about is something that is very common, that all of you are very familiar with, something that has been with us for many, many years. And you know that the history and of the histopathology of cholesterol atherosclerosis stretches more than 100 years ago. And along the years, with further research, epidemiological studies, interventional studies, we managed to prove 2 things. One of the core risks of getting heart disease is because of high cholesterol, and there are ways of treating it. There are many good drugs that are with us now, but unfortunately, many patients are very reluctant to take these drugs because they have been misinformed about the good and the bad things of the drug. And when you go to the pharmacies, for example, and you buy any medicine, or maybe if you were to go to the coffee shop and talk to your friends, they always say, don't take statin because statin has a lot of side effects. That has time again been proven wrong. Unfortunately, lessons from history, anything that is wrong, if you speak to it 100 times and 1,000 times, it will suddenly becomes truth. So when people keep talking about things that are not good and keep repeating it, even though it is wrong, but at the end of the day, it will appear to be truth. And it is a very sad thing to hear. Why? Why do people do not want to take proven medicine? Because they always believe that supplements work. So unfortunately, supplement market is a very big commercial market. I think the pharmaceutical industry earn a lot of money from selling supplements. And to me, as practicing cardiology, supplement has never been proven to prevent cardiac event. There are many clinical trials being used, even for antioxidants like vitamin A, vitamin E. They have not been proven to prevent events. Fish oil, Q10, all these are just to make you feel better and has never been shown in clinical trials to really help in preventing events and sudden cardiac death. So taking supplements will make you feel better because you always feel that you're in control. Psychologically, it may also help, but financially, it is toxic, meaning it is not cheap. So I always tell my patients, try to stay away from supplements, but try to take things that are natural, fresh fruits, vegetables. Right? The fact that we do not take enough fresh fruits and vegetables, one of the reasons why it happens is because of the presence of supplement. How I wish life can be so simple. You just take one medicine and it can solve all your problems. But in actual fact, you do not have this kind of one size and fits all approach. And the other common supplement that most people will take is fish oil. I think you have to agree with me, if you have friends from Japan, you know, our Japanese friend, they would never take fish oils because they will prefer to go and buy fresh tuna, fresh salmon. And in fact, if you have gone to Japan, you know, in Tokyo, they have a specific fish market where you can go and buy good and fresh fish to consume. So before you think hard and buy supplements off the counter next time, please remember, it is something that you're going to spend money on and you're not going to get a lot of benefit. If you were to Google, you will find that one of the two doctors who did research on LDL cholesterol, they were Nobel Prize winners. But this happened more than 30 years ago. And in that particular paper that they presented in 1986, they find that actually we do not need a lot of cholesterol in our body. The normal LDL cholesterol that we need is probably around 25 milligrams. Whereas in actual fact, most of us have a cholesterol level of 150 to 200. So even you bring your cholesterol down to low levels using statin, it is not going to harm your body. Okay, this is a blood vessel belonging to a patient, and you can have a clear look at the blood vessels, and it does look normal to me. And this is done via our coronary CT angiogram. So do you want to prevent disease, getting such good and nice looking blood vessels, or do you prefer to come in and get a heart attack? Before I proceed further, I would request that if your microphone is on, is it possible for you to mute your phone so that I may not be able to hear your voice. So if you look at this coronary angiogram result, this patient actually coming with a heart attack. You can see that this is a left anterior descending artery, one of the most important artery that supplies the front part of the heart. And it is close to getting blocked off. All right. So you can choose to prevent heart disease and not having end up with this problem, or you can choose not to do anything until you come in and see us in this critical situation. But of course, we can sometimes manage to do some procedure and open up the blood vessel. Okay. But you need to understand, not all patients who have heart attack can be so lucky. Yeah, many of them can just die suddenly at their home. And in fact, 20-30% of heart attack patients can die suddenly at home, and they may not even have a chance to come and see us. So in actual sense, you may not be so lucky. Why are we worried many a times? Because many diseases around us are very silent to start with. You will always feel good. Even if you are diabetics, you may not feel anything abnormal with you. If you have high blood pressure, you feel totally well. If you have high cholesterol, you do not have symptoms. Okay, the fact that you can run marathon, you can do Ironman, you can go up the Great Wall of China, you can climb Mount Kinabalu, doesn't mean that your heart is healthy. Exercise is good, but unfortunately, it cannot solve all your problems. So I hope that please do not assume that you are healthy, even though you don't have symptoms and even though you can exercise well. Okay, that is not a very correct assumption sometimes. Stuck again. Can't work. Okay. Okay, these are some of the other statistics that I want to show with you. We have around 8 million individuals in Malaysia that have raised total cholesterol. Many a times you will not know that your cholesterol is high until and unless you get a blood investigation done. So please get your blood investigation done on a routine basis, okay? And 1 in 4 of us are not active. We do not exercise enough. So sedentary lifestyle is not something that is very good. And around 30 to 50% of us smoke. And that is also a risk factor that you strongly need to stop so that you can have a healthy heart. And there are many drugs that are available now to get yourself treated. I personally do not like to prescribe drugs unless you really need it. I always believe in prevention, but many a times when patient comes to see me, they are already at a stage where they need medication. Okay, so even if you are being prescribed medication, please always remember to take them, because if you don't take the medicine, the drugs don't work. And these are my final words of advice. If you are 40 years and above, I'm looking at the Western data. So in the Western data, you're 40 years and above, or you're a lady who are postmenopausal, you should get yourself screened. Please go and see your GP, or you come to the hospital and see a cardiologist if necessary. If you are a smoker, if you are diabetic, if you have high blood pressure, if you have high cholesterol, or even if you're healthy but you are very actively participating in sports, like you do Ironman, you run marathon, please make sure that your body can take it before you start. Or you have very bad family histories. You have many of your relatives who get heart disease, stroke at a very early age. All these are telltale signs that things are not well. If you are overweight, you are obese, or if you are a snorer, all right, or you have kidney disease, you are in a high risk group, please do come early to get yourself screened. I would like to draw attention to this slide. This is a very important slide. This is again data taken from the National Health Survey in 2015. You look at the age group of 18, 19, 20, 24, 25 to 29. These are very young people. And even among these young people, you can see that many of them already have risk factor for heart disease. That shows how unhealthy are Malaysians. And because of that, our Malaysian consensus suggests us to screen people for risk factors for heart disease at the early age of 30 years. So if you are 30 years and above and you think that you are not healthy, please do come get yourself screened before you run into trouble. And this is the least that you can do. Please exercise. As I always believe that exercise helps, but unfortunately exercise cannot solve everything. For example, I have many patients who have high cholesterol. They do not want to take medicine. They just prefer to exercise and they hope that the cholesterol level will drop when they exercise. Unfortunately, life is not so simple. Exercise will never drop your bad cholesterol. There are only 2 ways you can drop your cholesterol. Either you take good care of your diet, or you need medicine to help to bring down your cholesterol level. You need to have adequate uninterrupted sleep at night. You must be eating the right type of food and at the right portion. Don't smoke, don't drink if possible. Please come for yearly routine blood tests, because if you don't do routine blood tests, you will miss things like diabetes, you miss things like renal failure, you miss things like high cholesterol. And please check your blood pressure on a regular basis. And I can't re-emphasize this time and again, that blood pressure can be high and you can be asymptomatic. So a lot of times, by the time you come to the hospital with symptoms, it may be a bit too late and you may present with complications rather than just blood pressure alone. And please consult your family doctor or even consult your cardiologist if you are in doubt. Thank you very much. So I think I'll pass the podium back to Ronnie.
Okay, how is it, guys? So is everything has a hope and a future. Okay, so don't be afraid, don't be fearful. Embrace your exercise, embrace whatever you're doing to stay healthy and be strong. Any questions? Do you guys got any questions you want to post here? Dr. Chang will take 2 or 3 before we call Dr. Talal on air. Hi, doctor. For heart failure patients where bypass is not possible, not recommended by surgeons as not deemed safe, and are relying on medication, is stenting recommended? And how would we know whether stenting is safe? This is the specialist. You got the right person to talk. Dr. Chang is the specialist. Come on, Dr. Chang.
Okay, this problem is something that we see all the time. Of course, if you have multiple vessel disease, you have a very big heart. Sometimes surgeons may not want to operate because the risk of surgery is high. If your risk of surgery is high, that doesn't mean the risk of stenting is low. So you need to understand that. So at the end of the day, I always stabilize my patients before I do any procedure, unless they are really unstable. I have many patients where their heart function is weak, and now we have a lot of medicine that you can use for heart failure. And over the weeks to months, we manage to improve their heart function. Once their heart function starts to improve, then we can start to reevaluate your condition, whether revascularization would help you. So many patients, after their heart function is being stabilized, they have improved in their RV function, then we can actually talk to them about maybe getting surgery done then, because by then your risk of surgery would be lower. I hope that understand your question.
How do you stabilize your patients? Is it via medication?
Yes. So stabilizing of heart failure, a lot of times, of course, is through medication. Of course, patients need to be educated on how to look after themselves. They need to know how much water they need to drink every day. They need to cut down on their salt consumption. They need to make sure that they know their weight, okay? And they need to come back for frequent follow-up, because the medicine that we need to give it to you, we need to see you on a regular basis, and we need to slowly increase the dose of the medicine, right? So the good thing about treating heart failure now compared to 10 years ago is now we have tons of good medicine that you can use to treat heart failure. And many of my heart failure patients, I would say 80–90% of them, they do well. Of course, there are a small group of patients that whatever you do, they will never be better. But that is going to be a small group of patients.
Is sudden cardiac arrest caused by narrowing of blood vessels?
Yes. So just now, I start off the lecture on talking about sudden cardiac arrest. Sudden cardiac arrest can be caused by many causes, but the commonest cause is still narrowing of the blood vessel. All right. So if you, let's say you have a combination of narrowing of blood vessel or heart, and your heart is weak, for example, then your risk of sudden cardiac death would be higher, right? In spite of getting your blood vessels fixed. I'm sure you have heard of stories about your friend who has a procedure done, who had a surgery done, who has stenting done, and yet when they go back home a few weeks later, they die at home. This kind of scenario can happen because of the weak heart. So our weak heart need time to get better. Of course, there are ways and means of prevent that. We can implant devices, but a lot of times we do not recommend that because many patients will not be able to afford all these expensive devices. So other causes of sudden cardiac death could be related to familial genetic issue, but those are not very common. That's why I did not touch on it.
Can you please touch on hypotension?
Yeah.
Hypotension.
So hypotension is a lot of times drug related, I presume. Of course, hypotension can be caused by many things, but commonly is because of your high blood pressure medicine being too aggressively titrated, all right? So the definition of hypotension means you have symptoms What symptoms can you have? You may feel giddy, you may feel nausea, and some people can even faint, and the blood pressure may drop to maybe to the levels of around 90 to 100. So if you think that you frequently have hypotension, then something is not right with your medication. Please go and see your doctors early and get your medication titrated. Okay, so I will probably take another last question.
How many times to exercise, and will vegetarian help reduce?
Yeah, so talking about, yes, in Adventist, if you have come to our place before, we always advocate a vegetarian diet. Vegetarian diet is good, it's helpful, but of course, just like exercise, it will not solve all your problems, okay? But it's good to take vegetables and fruits regularly. And I think Malaysians as a whole, I think from the data, we are not taking enough, because it has a lot of benefits. At least it does not increase your bad cholesterol. If you have someone who has very high LDL, taking vegetables would help in the process of reducing your bad cholesterol, right? Rather than taking too much meat.
One last question.
Which one?
This is a very important question.
Oh, okay.
9-year-old had frequent annual health check with
Yes.
son. No problem.
I am glad that you bring out this issue. Okay, maybe I'll just talk about this question, yeah? So one of our friends here asked about one of my friends, a regular hiker and runner, a 49-year-old had frequent annual health check with stress test done. No problem detected. But recently he died while resting at home. How can we detect this earlier? I have seen patients having this problem, and I would like to re-emphasize one thing. A normal stress test does not mean that you are totally well, because there are small little plaques that can form in your blood vessel that stress test would not be able to pick up. So a lot of times I still do stress tests, but if the stress test is normal, I will not tell the patient that you are 100% fine. I will always ask them to consider doing another test to make sure that they do not have early heart disease that is not being picked up early by a stress test. So what can we offer? We can do tests like a coronary calcium score. Okay, we can see whether there's a lot of calcium deposits in your heart or not. And all this can be picked up just like doing a simple CT scan, and it's not very costly. It is probably maybe 500 ringgit per scan, and you don't need to do it on a yearly basis. Okay, so maybe I just touch on one of the patient that I saw him today. He has been doing stress tests for I think 4 or 5 years in our wellness center, and he's well, but he's already 58 years old. He has high blood pressure and he has high cholesterol, but unfortunately his cholesterol was not very well treated, and I told him that he need to have an alternative test to check to make sure that he's truly well, because he's also actively exercising. And when he did the calcium score, normal people should have 0 calcium in the blood vessel in the heart. His calcium score is around 500 to 600, and that's considered very high, right? So these are the people that we need to pick them up early and treat them aggressively. And by doing so, you can also reduce the risk of them dying suddenly because of heart attack. And probably to add on that, for people who are overweight and who have a lot of snoring at night, please come and see your doctor early. Many of the people who die suddenly in their sleep at night are the snorers. So if your wife or your sleeping mate complain that you are very noisy and you disturb their sleep, that means something is really not right with you. Please come and see your doctor early, because many of these people who snore at night, they not only snore, they stop breathing. And they can stop breathing for like 1 to 2 minutes, and it's very scary. And during those times when they stop breathing, the oxygen levels will drop and the heart will be stressed, and bad things can happen during that time. So I think I need to stop now, because I think I need to pass the podium back to Ronnie, who will introduce our great surgeon, Dr. Tala, to you. And I'm sure you can learn more things from him. Thank you very much.
Thank you, Dr. Chang. A very big hand. Sadly, we don't have a hall where we can clap. Anyway, I see a lot of questions, a lot of very good questions. Don't worry. You know, when we started the talk, we now have online making appointment. We can make appointment. Now you can make appointment. You can get to see Dr. Chang at your own time. You don't have to come and queue any longer. Now we have an online app. Just download the Penang Adventist Hospital mobile app on your phone, and you can see Dr. Chang's time availability, suit it to your time, and then you can make the appointment and come accordingly. Okay, without further ado, I'm going to invite our very famous and popular Dr. Talal. Big hand.
Good afternoon, everyone. Let me introduce myself first. I'm Dr. Talal Rida. I'm the consultant cardiothoracic or heart and chest surgeon here in Penang Adventist. Let me highlight one issue first, because all my patients were the first time they come to me, they ask me about this question. What is the difference between a cardiologist like Dr. Chang and like myself, the cardiothoracic surgeon? So the difference is that Dr. Chang is actually the first step to see the patient. He is the first to see our patient, and then he is the one to make the diagnosis. He is the one order the tests, and he is the one dealing with the medical treatment of the patient, whether it's diabetic patients, whether are hypertensives, and then he will do eventually the cardiac coronary angio or cardiac catheterization. He will diagnose all of this, and then he can treat also by putting the stent or dilatation of the arteries. And then after that will come my role, when he come to me and he will tell me, I have one patient that needs your help for surgery. So I am the surgeon. I'm the one who use the knife all the time. I'm the one who's doing the cutting. So actually, recently, we discovered, or the whole world discovered, that the collaboration between these two cardiologists and cardiothoracic surgeon, they are calling them the heart team. So everybody now all over the world, they are stressing on the fact that the heart team is very important in taking the decision for the best choice for the patient, whether a medical treatment, stenting, or surgery, which is a bypass. After this introduction, I'd like to start my slide presentation. And let me tell you that I made it very simple. The subject is so big. I'm looking forward for future webinars with you to tell you more, and then actually to highlight about the different kind of surgeries that we have. So I will make it very simple and very short, and to listen more to your questions. Okay, so what is the impact of coronary artery bypass surgery to prevent the sudden cardiac death? I want to give you an idea about the coronary bypass, which seems to be like very scary to many people. So I want you to have this, after we finish the talk, to have this safe feeling about going for surgery, and don't hesitate, because it's saving lives actually. So let's talk slowly about this to approach this idea. So what are the treatment options if you already discovered that you have a ischemic heart disease or heart problem? So as I said before, Dr. Chang either will start medical treatment if your case is mild, the blockages are minimal, one vessel or less than 40%, and can be managed by medications, or he will see that no, your blockage is more than that, and it will need an interventional treatment in the form of angioplasty or stenting, and especially in emergency situations, like we call it the primary PCI. Sometimes people will present in the ER with severe chest pain, and then Dr. Chang will straight away take them to the cath lab, do the angio, find one artery is so much blocked, and within a certain period of time, if he succeed to open this artery, so it is as if nothing had happened, he saved your life and he saved your heart. So we come to the third option, which is my specialty. It's called the coronary artery bypass grafting, which can be done in all cases except the mild cases, as I said before. Okay, let's talk a little bit about angioplasty. Not so much, because Dr. Chang already covered a lot of issues there. So angioplasty, actually, the idea of stenting is to restore the normal caliber or the diameter of the coronary artery by means of a balloon dilatation, leaving a stent behind to keep the coronary artery lumen open for longer time. So this is a very simple definition of what we're doing in the procedure. If you look at the left side video, you will see the procedure is by putting a wire inside the artery, and then you can see the blockage in the artery. Then the balloon will dilate, will push out the blocking, restore the normal caliber, and then leave the stent, which is like a mesh. You can see it in the video, and then the artery will become normal again. It's still a diseased artery, but actually we already dilated it. We are making it back to normal again. So the next question that I always hear from patients, who can and who cannot go get angioplasty and stenting? It's not an haphazard question. It's based on evidence-based or guidelines. So on the right side, lower corner of the slide, you can see my source that I based my talk about is the 2018 European Society of Cardiologists and the European Association for Cardiothoracic Surgeons, which is actually a hard team. Is the team of cardiologists and the team of cardiac surgeons. They sit down together, they made a task force, and this task force came with a recommendation based on a research, and this research is called the evidence-based. Evidence-based means many centers have already put their results, and they already concluded that this is 100% sure the effect is correct and is an evidence-based. So according to the guidelines, people who are diabetics with multi-vessel disease, and when we say multi-vessel disease, it means 3-vessel disease or more, okay? So this multi-vessel disease or 3-vessel block benefit more from bypass. According to special scoring system, there is another thing. So the whole thing is more complicated. I'm trying to make it very simple. There is a scoring system it's called syntax scoring system. This scoring system, forget about the name. The idea of this scoring system is to put a figure that the cardiologist and the cardiac surgeons will agree on, that this figure, below this figure, patient can go for stenting. Above this figure, most probably surgery is the best for him. So the syntax score is 22. It's nothing got to do to calculate this syntax score. Is we are the one calculating, the cardiologist and the surgeons. And actually there is an online, the website will have the online calculator, which is very easy for us to do. Based on your cardiac angio or coronary angio or the cardiac catheter results. Okay, yet we cannot ignore the role of primary PCI, like I said before, when the patient comes to the ER and Dr. Chang will take him, or the cardiologist will take him to save his life for a blockage of one artery. Okay, so it's the heart team responsibility, again, to discuss every patient case according to the guidelines and choose the best option based on medical evidence, only on medical evidence. Let me talk about small issue here. Sometimes we get patients that say, oh, I want to go for stenting. Okay, we advise them that your case is better to be bypassed, but they insist of stenting. Why? Because stenting is a very simple, it's a simple procedure. It's a less invasive procedure than the bypass. Of course, the bypass is cutting, and then also where patient will have to stay in the hospital longer time. The stenting, the patient stay maximum 2 days, and it's he is awake during the procedure most of the time, and the procedure take half an hour to 1 hour. If stenting more than one artery, may be taking 1.5 hours. But you go against the recommendation that was based on medical evidence because you want a simpler process than surgery. This will have a consequence. These consequences I always discuss with my patient. It's okay, you are the one who choose, but also we have to choose to give you the best thing or to refrain from listening to you, and then you will blame us after that. Okay, so this is a point I want to say. Choosing the proper decision or taking the proper decision according to our medical advice is crucial here. Okay, so let's now discuss about why cabbage can save from sudden cardiac death. Okay, Dr. Chang already explained many things about sudden cardiac death. The most important thing in sudden cardiac death is arrhythmia. Why is arrhythmia? Arrhythmia is a medical term, means that the heart is not pumping regularly like a clock. Our hearts used to pump in a regular rate, means it's like a clock. When this rate is disturbed, then we have problems. So the most common cause of sudden cardiac death is ventricular arrhythmia. And what is the most common cause of ventricular arrhythmia? It's almost always ischemia, or the blood is not reaching the heart properly because of the blockage of the coronary arteries. That's why we have this kind of arrhythmia. Arrhythmia can be of many reasons. The most common one is ischemic heart, like I said, but there are other reasons. And maybe this is one of the things that one of the questions now, very important one, about the 49-year hiker that is seems to be totally healthy individual with a regular exercise and the regular checking of his of heart condition, can die from arrhythmia, because arrhythmia have different causes. So arrhythmia, once the heart goes to ventricular fibrillation means the heart is shivering, is not pumping. So when the heart is shivering, there is no blood supply to all parts of the body. And in this situation, people can die suddenly, immediately, unless they revert it. And that's why all the time we are stressing on the CPR for the public. So to learn how to do this if you find a person in this kind of condition, to save his life. Okay, so what cabbage is doing to save the patient from sudden cardiac death? On the right side here, you can see a study published by one of the most famous German centers, and they are exactly the topic is our topic is a coronary artery bypass graft surgery for the prevention of sudden cardiac death. So the whole idea is that when you restore the good blood supply to the heart, you are going to stop this kind of arrhythmia, this kind of ischemia that will lead to the sudden cardiac death. Okay, so this study compared two groups of patients. One had medical treatment, only taking medicine, plus they implanted something called implantable cardioverter defibrillator, which is a small device they implanted in the left upper shoulder of the patient. And this device will monitor your heart rate day and night. And they implanted mostly in the heart failure patients. Okay, this device is working like someone who's taking care of your heart. It's monitoring your heart. Once the heart rhythm, like I say, become VF, it will give a stimulus or give a DC shock or give an electrical current that reverted it back to normal. This ICD, once upon a time, was very famous in saving a lot of lives, especially the heart failure patients who are more susceptible to this kind of arrhythmia. So this group, this study compared two groups. One big group that was treating with medical medications and ICD, and another one that had cabbage and surgery. The cabbage group have 0% sudden cardiac death compared to 3.1% in the group where used the medications and the ICD. There is another, the slide cannot move, huh? Okay, there's a leg, yes. So, okay, let me tell you why we should not delay the surgery, which is another important topic. I keep having patients day after day during my career coming very late for surgery. Why? Because they are scared to go for surgery. They go everywhere. They try many cardiologists. They try many doctors. And then every doctor will end up by telling them, oh, I cannot do anything. You have to go for surgery. I cannot do anything, have to go. But he keep trying because he's very scared to go for surgery. So let me tell you important points. Going for CABG once indicated will make surgery success higher as the heart muscle function is still good. And it's also going to prevent damage to other organs because either because of excessive medications or the weak heart. So if you continue to take excessive medications, it will affect your kidney, it will affect your liver, it will affect other systems of the body. But when you do the surgery will make half of this or 1/4 of this, only one quarter of these medications that you will consume after the surgery. So you are also protecting other parts of the body. So it will also, the surgery will prevent unexpected stroke, which is the brain stroke with the coma or whatever the complication, hemiplegia or the paralysis of one of your side of your body, is because this stroke, this stroke will come from arrhythmia, like atrial fibrillation, will make a clot inside the heart and go to your brain. Finally, age factor. The younger you do the surgery, the more successful it is. It is logic, right? I mean, if you go for surgery while you are 80 years old, then it's not like going for surgery when you are 60s, okay? So it's like this. Going for surgery earlier will prevent a lot of problems. Actually, it will save you from a lot of things, a lot of money, because you are going for surgery immediately. You will have a smooth course, and then after that, everything will be okay. Let's move to the next slide. How? No. Okay. Let's talk about coronary artery bypass surgery very quickly. We offer you 3 types of surgery depending on your case. Either we do the on-pump CABG, or we do the off-pump CABG, or we go for the minimal invasive CABG. So I arranged them like this because the on-pump CABG is the most common technique. Heart-lung machine is used, midline sternotomy, or we breaking the bone in the middle, cutting it in the middle, and all trained cardiac surgeons can do it. Almost all cases of CABG can be done with this technique with variable risk. Now we move to the next level, which is the off-pump CABG. Why is the off-pump CABG? Means that we don't use the heart-lung machine. So needs highly trained surgeon, well-trained surgical team. So only around 5% of all surgeons can do the off-pump one. The heart-lung machine is not used, like I said, still is a midline approach with cutting the bone. It's highly recommended for patients with weak heart, with stroke, kidney problems, and liver problems. And let me stop. And this weak heart, because of the heart failure, we have done a lot of cases that cannot be done for surgery of heart failure with the off-pump CABG than the on-pump CABG, because in heart failure, on-pump CABG is very difficult, high risk. Off-pump carries lower risk for the patient. So I've done patients with a low function of the heart on the off-pump successfully. Okay. Now we move to the last level of that we can offer you is the minimal invasive. Means what minimal invasive? Means we are going to do the cutting, is called the keyhole surgery. We're going to do the cutting on the left side of the chest instead of cutting the bone. So it needs a very highly skilled surgeon, specially trained team as well. So it's not using the heart-lung machine. So it's some sort of an off-pump. It's an off-pump as well. So left side of the chest approach, there is no bone cutting. We are going in between the ribs, like I will show you the next slide. It's for selected patients only. And there are a lot of criteria for it. For example, you cannot be smoking. You cannot be a heavy smoker and you want to go for this because your lungs are not good enough to withstand this kind of surgery. So it has an excellent recovery, and the patient is almost, sometimes they didn't notice, the family didn't notice that the patient go for surgery at all. So you can see here on the left photo or picture is the patient with a midline incision and the on-pump or off-pump bypass. And on the right side, this is the minimal invasive with an incision just under the left breast or the left nipple. And this is how this is the difference. Here, the bone is intact in the middle. Here, the bone is split into two. Both have good results if off pump, but because of course the minimal invasive have faster recovery and faster going out of the hospital very fast. Okay, now if we do a minimal invasive surgery in our hospital Adventist here, so the grafts that we use for the bypass are either we use arteries, that's why I put them arteries, the red color, or veins, and that's why I put them like a blue color. And then we use the endoscope. So we recently use the endoscope, which is a device that make a very small hole, like you see on the upper left corner picture is the picture of the hand that we took the artery from the hand through a very small incision. This is the conventional method that we take very long incision with the surgery without using the endoscope. And you can see the difference in the scar. This is a very small scar on the left side, and then it will go away. You cannot even see it after a few years. This one will keep growing a keloid most of the time, and it will look so ugly. If we look at the bottom side picture of the leg, which is taking the vein, you can see a very small incision of the scope, the one I'm pointing at, compared to the right side picture with a very long incision that is done to take the vein. So if we are doing minimal invasive, we are trying to minimize. If we're doing also from the middle line, we are trying to minimize our incision. So this will makes you not scared about having long incisions and disfiguring incisions that everybody is looking at you. Almost all, you cannot see these incisions after quite some time. Let's move to, we almost finished. Okay, so let's conclude what we said just now. Coronary bypass protects from sudden cardiac death by restoring good blood flow to the heart. The bypass procedure is a safe procedure with a success rate of 98% in most cases. And I'm not kidding, this is our figures, and these are even the international figures. So if you are in good hands, you get 98% success rate. So don't be scared from surgery. The next that we have to take home message is that different types of CABG procedure can be done, and we can offer you according to your situation or your current case, different types of surgeries. The minimal invasive CABG is the newest technique with excellent fast recovery and less need for blood transfusion. Checking your heart condition regularly and choosing the right treatment as early as possible will save you from sudden death. And this is a very important point. Coming early is always a benefit for you. Thank you for your attention. You can reach me on the email or the hospital number here, or you can contact the hospital at any time. Thanks. Any questions? Yeah, sure. Thank you so much. Thank you.
Okay, any questions, guys? Please post your questions here.
Hi, Dr. Tala. We had consultation with you last year. Diabetic patient with multivessel did not recommend to bypass. How do we assess whether stenting is possible or just rely on medication? Okay, if you're, for this question, this one question saying that we had a consultation with you last year, diabetic patient with multi-vessel disease and not recommended for bypass. How do we assess whether stenting is possible or just rely on medication? Okay, this is a very good question. Most probably, the patient came very late, and this is what I was stressing on just now. Coming very late makes the heart very weak. And also there is another thing from my surgical point of view is that the target arteries that we're going to bypass. Sometimes when you come so late, the whole artery will be blocked. If the whole artery will be blocked, there is no point to put a bypass. So from the word bypass is that you have a block on one side of the artery in the middle, for example. So you can bypass the artery with another graft after the blockage. But what if you have the whole artery blocked? You cannot put the bypass. So the patient will not be, benefit or eligible for the surgery, okay? So your question is how to assess again. So if you want to assess again, you can come again. The only way to assess again is to do a coronary angio or a catheter one more time, and we see how is the situation. And from there, we can decide what to do. Another?
Heartbeat lower than 50 beats per minute.
No, the heartbeat lower than, another question is saying the heartbeat is lower than 50 beats per minute. Does this mean a weak heart? No. There are some people that are genetically have lower heartbeat than others, and also as well lower blood pressure than others. Is a familial thing. It doesn't mean you have a lower blood pressure or lower heartbeat that you have a heart problem or the heart is weak. Of course, it can result from a weak heart, but it can result from medicine, genetic, or any other things like disturbance of the electricity of the heart. So if your heartbeat is 50 beats per minute and you don't have symptoms at all, like you are dizzy, like you are not feeling well, that when you are doing exercise, you cannot do exercise, means that most probably your family is like this. So look to your brothers, sisters, father and mother, see if one of them have the direct family members. If they have such a thing, then most probably you are okay. If you are so much concerned, you can come to the hospital. We can do something called Holter monitoring for you, which is a device that we can attach to your body through the external electrodes, and you carry the device for 24 hours up to 3 days, and it will record your heartbeat, and we can say if this is normal or not normal. So this is also because Dr. Chang had a question before about hypotension. He already replied about this part of people taking medication, but there are normal people that their blood pressure is on the low side. And when their blood pressure is on the low side, it doesn't mean this is a problem. It depends. If he can live his life normally, then it's okay. You don't have to raise your blood pressure. You will build to be like this. It is if it is not good with you, then you will start to have symptoms. So don't do anything about normal situations. Other question? Okay. I hope I covered everything. It was a long talk today.
Okay.
I hope everybody has already.
Another question.
Last one.
What's the recommended maximum heartbeat per minute while doing vigorous exercise? Okay, that's very good question, actually. That's a very good question. Now, the technology has allowed us to use devices that will recommend you the best heart rate for your exercise and not to exceed it. Let me show you one piece of these equipments, like my watch, or the Apple Watch, or this kind of, I don't know if you can see or not, this kind of earbuds. Okay, so all what you have, because everybody is different. According to your height, your body weight, your age, this is a calculation that calculates for you your mild zone of heart rate, your moderate, and your high zone of heart rate, that is the excessive or the maximum. So when I do exercise, I use this one. They will take the record the heart rate from my ear or the watch as well, the same, and then they can play to you. They can do the coaching. Is the real life one. When I'm jogging, slow down. You exceeded your heart rate, and go further. or you're still in the light zone, you are in the moderate zone. For hiking, I recommend you to buy one of these things because it's immediately will advise you to stop and it's very safe. Hi, Dr. Talal, would you recommend having a blood pressure watch to constantly monitoring blood pressure? For example, yeah, of course. Of course. Of course, it's better to have, like Dr. Chang say, a blood pressure machine at home, especially if you are in an age group that is having, like, for example, for men above 40 years old and for women above 45. And especially if you have family history of hypertension or diabetes or anything, and especially so much if you are already on antihypertensive medication, of course, I recommend 100%.
Okay, doctor. I will.
Okay,
Okay.
anything else?
Nothing else. Nothing else. We will close, doctor.
Okay.
I'll come and close.
Okay.
Okay, guys, thank you so much for joining us today. I believe it was a very fruitful session. Don't worry if those of you who had posted more questions at the end of the talk. If you would like to continue to ask or what, you can do so. I think my colleague posted just now. You can type to enquiry@pah.com.my. Or alternatively, if you want to take the first step to ensure that your health is perfect, you can also do so by writing into our inquiry line. We will try and make an appointment to set you up with Dr. Chang so that he can do a complete scan, checkup. But if you are an existing patient, you can download, as I said earlier, the Penang Adventist Hospital mobile app. You can make your appointments to there. So thank you. And once again, happy Father's Day, all of you. We had a good time with you. We hope that we can do this more often. Thank you so much, Ana Hutan. Thank you, Brother Kenisin. I want to thank you someone also because without her, I couldn't maneuver the Zoom talk. This is Tien. Let me introduce you to Tien.
Hi.
Okay. So thank you so much, guys. Have a great day.